Hello, everyone, and welcome to the very first stream of the year. Joining me today is Dr. Kathy Staropoli and Dr. Saban Kirksey. These wonderful ladies work in our Women Veterans Clinic, and they're going to talk to us today about the importance of getting screened for cervical cancer. Before we move forward, though, I want you to like the or follow us on Facebook, YouTube, or Twitter. And also, if you have any questions, we will be able to see them from wherever you're watching. So just put them in the comments section and we'll be able to answer your questions. So welcome, Dr. Staropoli, and welcome, Saban Kirksey. I am so grateful that you're here to talk about cervical cancer. So let's start. Maybe you could both tell us a little bit about your roles in the Women Veterans Clinic, and then we'll start talking about the importance of screening.
Sure, Dr. Starpoli, go ahead. I'll follow your lead.
Okay, well, I'm Kathy Starpoli, and I am the medical director for women's health here at VAMX, and it's a role I've had for many years now, decades actually. And I work with Siobhan to improve our services for women veterans across the VAMX. And I would say that's probably kind of it in a nutshell as my role as medical director. I'm also a physician in our women's health clinic. I am a general internist and I provide comprehensive primary care to our women veterans. I also run an elective for medical residents to learn about taking care of women comprehensively. And I've worked with the national office on many educational initiatives. And I'm really happy to be working here with Siobhan Kirksey.
Thanks, Dr. Starpoli. So I am Dr. Siobhan Kirksey. I am the Women Veterans Program Manager here at the VA Maryland Healthcare System. My role in a nutshell is very high level. My goal working with Dr. Starpoli is to ensure that our women veterans have adequate access to healthcare across any of our VA systems. So that includes our community-based outpatient clinics, but also making sure that I support with any outreach efforts as well as education. So we still have a number of women veterans that don't realize that they are eligible and could benefit from this service. So I take time to make sure not only do we educate anyone that's newly coming into the VA as employment, but also go out into the community to ensure the same access and make sure that they have the same information.
So when we say women veteran, a lot of women who can you define women veterans so that women veterans know who they are? Many people don't identify as such, even though they are. So
I
can you?
know, I know. We've heard this a lot, and it is a big deal. So anyone that has served any branch of service, including some guards and the reserves, would qualify for our service. So anyone that has served any time in military service could have the option to qualify and benefit for our healthcare access. Now, since we are on the healthcare side of the campus, we don't usually make that decision. We collaborate together with our Veteran Benefits Office, who helps together determine who would be eligible based on service, but it is anyone that has actually served time through all of our branches of military service. And we want to make sure that they have the opportunity to explore whether or not the benefits apply to them. And so there's specific things that our Veterans and Benefit Office would do to help support that and go through the process. But they make that determination. And once you are, then we on this side help and ensure that they are able to access appropriate health care.
So anyone who's put on that uniform and served in any branch is a woman veteran. Any woman
Correct.
veteran who put on the uniform. So,
Yes.
and also tell us a little bit about the ages of the women you serve. Is it just young people? Is it just old people? What is your age range for patients?
I wish I could say it was just young and old. In the very beginning, I would say most of our demographic initially would be our 45 to 60s, but we've seen this huge trend because of the growing rise of our women veterans kind of serving. So now our mixture looks more towards our 20 to 30-year-olds. It's kind of high and very populating when it comes to those veterans accessing healthcare and coming in for services. So I would say our 20 to 30-year-olds and still our 40 to 65-year-olds, that nice little niche spot, are still our fastest growing. The numbers that we see decreasing, though, are in our older vets. If they now qualify for Medicare services, we do see a little bit of their access kind of dwindling a little bit because they're utilizing more of their Medicare. But we do see our young veterans kind of more so accessing and coming in to receive healthcare access and benefits.
So, in regard to cervical cancer, I'm thinking that no matter how old a woman is, a woman in general is, women veterans in particular, who is our demographic that we serve, why is it important to get that cervical cancer screening? So maybe we should talk a little bit about what cervical cancer actually is and talk about what the screening does.
Yeah, I wanted to just add on to what Siobhan was saying, that 18% of our veterans are women right now here at VAMIX. So this is huge, right? That's almost 1 out of every 5 veterans that we serve here are women, and many of them are young. More and more, we're seeing people that separate from military service in their 20s, in their 30s coming in. We see people who are older who discover that they have benefits that are coming in. But in general, the people that are coming in relationship to cervical cancer, they all need screening. So, what is cervical cancer? So, the cervix is part of the uterus. It's the part of the uterus that extends into the vagina. And this can develop cervical cancer. How does this happen? We used to not really know, but now we know that the virus, human papillomavirus, is the causative agent of cervical cancer. And how do people get HPV, which is what it's called? People get this through sexual contact. Okay. In order to develop cervical cancer, it's not a one-time thing. It's not like you get exposed to HPV from some sexual encounter and you're going to develop cervical cancer. Okay. And I think after COVID, a lot of people are starting to understand a little bit more about immunology, chronic exposure, inability to get rid of viruses, and things like this. But what causes cervical cancer is human papillomavirus that is persistent. So most women, if they are exposed to HPV, they clear it like we would any other kind of virus. And that's it. And they go on and there's no more HPV and they are not at risk. Now, some women, for whatever reason, do not clear the virus and they wind up having a more persistent chronic infection. Okay. And that type of chronic infection leads to changes that are precancerous and that can go on to turn into cervical cancer. So if someone has HPV once, at one data point in time, we worry a little bit. We want to follow and see what happens. Most of those people will clear it. There's been studies of 24-year-olds, and more than 25% of the population has HPV at any given time. All those people are not going to develop cervical cancer. The vast majority of them are going to clear it. This is why we don't even check for HPV in younger populations, because the prevalence of having it at any given time is pretty high. And most of those people are not going to go on to have any kind of chronic infection or changes. So we don't even check it because it would give us way too much information that's not useful to us. So if people have kind of a chronic infection, it can cause changes that will lead to precancerous lesions and eventually cervical cancer. This takes a long time. It takes a long time for cervical cancer to get from being exposed to HPV and kind of having a chronic infection over a couple of years to developing actual cervical cancer. 10 years usually this takes. So we have many, 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 many opportunities to check people's pap smears to see kind of what's going on. A pap smear is basically just a swab of the cervix to look at the cells. That's basically what we're looking at. And the pathologists take a look and they see if there's anything that looks abnormal, precancerous, and they basically read it and they let us know kind of what's going on there. So that's just a little bit about cervical cancer and how it forms. Why are some people more at risk? Well, people who smoke are at higher risk. They're at higher risk for all cancers because the smoking can affect their own ability to fight off these cancers. Okay, it can affect the immune systems, can give problems with the genes that fight against cancer. So that's one group of people that are at higher risk. Another group of people at higher risk are people that are immunocompromised. And that's because these are people that, like any other virus, they have a hard time getting rid of it, or a harder time than average risk people clearing the virus. So who are immunocompromised people? People that have HIV, people that have diabetes can be, people who are on steroids or other immunosuppressant medications. For example, people who have organ transplants. These people are at higher risk for cervical cancer, and we screen them a little bit differently. Maybe not the diabetes, because that is not as much of an immunosuppressant, but some of those other conditions, we don't go by the general screening guidelines because they are at higher risk.
So if one were to get screened at a younger age, and they are found with precancerous cells, then what happens? And the reason I ask this is because I know someone who was early 30s who was diagnosed with cervical cancer. So what ages are we looking at where it can develop? So, and what happens if the pre-cancer cells happen or are found as opposed to the cancer cells? Like, is there a difference?
Yeah, so there's a big difference. So in general, like I said, it can take like 8-10 years for frank cancer to develop. So we usually start screening people after the age of 21. This is now the guidelines for cervical cancer have changed a lot over the last 15-20 years. Everybody used to get a pap smear every year, right? That was like, the most, the thing that was really, really driven into women, get your pap smear every year. But we don't really know about this HPV situation. Now we know and I'll talk a little bit about younger people, but in people who don't have such a high prevalence of HPV, that would be women 30 and older, we actually check for HPV. If they don't have HPV infection, they already go to a lot lower risk. We don't need to screen them as often. Younger women, like I said, we don't really check the HPV. We do check the pap smear. And if it's abnormal, depends upon what is found. Sometimes people need to go for a colposcopy. Colposcopy is where they actually look at the cervix. It's like going for regular pap smear, except they've kind of got a sort of a microscope that they can look. They kind of swab the cervix with something that they can see where changes might be. And if they find anything, they just do a little biopsy. And that actually gives a tissue diagnosis of what's going on. And it depends upon kind of what stage of precancer it is. But from there, there's kind of a whole set of guidelines about, do people need to have that acted on? Do they need it, lasered to get rid of it? Is it something that's pretty low risk and we'll just do another pap smear in a year? We'll follow up in a year to figure out what goes on. Do we follow up in 3 years? Do we follow up in 5 years? So it's very rare that we actually come out with cervical cancer on a pap smear. It's very, very rare. This is pap smear screening is one of the great examples of public health and screening. The incidence of cervical cancer has gone down enormously in the last 120 years. Enormously. I mean, this used to be a leading cause of cancer amongst women, and it's not anymore. It's not one of the leading causes of cancer. It's still a cause of cancer, but it's not like it was in the early, 1900s. And still worldwide, cervical cancer is, I think, the fourth most common cancer amongst women, in places where people are not being screened. So cervical cancer screening is a big, big, big success story because we have a big window to find abnormalities and we have good testing tools. And the other thing that is really developed, like I said, in the last 20 years, is that we are not over screening people. We know we can identify who is at low risk. We don't need to be screening them so much because, every test we do, there's a possibility of what we call false positives. Something comes out, it's not really the case. Nobody has any kind of problem. The test is abnormal, and tests beget tests, and it's procedures and all that other kind of stuff. So, if we don't need to be doing all these things on people, we shouldn't be doing things on them. They can be harmful in the end, if not psychologically harmful to physically harmful. It might lead to procedures that have complications and problems. So we've been able to identify people who are at low and high risk now with these different testing strategies. So cervical cancer screening is an important screening test, and it's a very effective screening test.
Can you talk a little bit about how the HPV vaccine has been helpful, and your recommendations for it? I read articles that said that both men and women should get this vaccine. So can you talk a little bit about that?
Yeah, so it's been suggested, the HPV vaccine, I can't even remember when it came out, probably 10, 15 years ago, maybe in like the early 2000s or so. So we've had some evolution of the HPV vaccine. And the idea is that there are, even within human papillomavirus, there's a lot of subtypes, right? Like think about COVID, right? Things mutate, there's different subtypes, right? I think everybody is a little bit familiar with this now. For HPV, we have high risk subtypes, that high risk for developing cervical cancer, and low risk subtypes. So the vaccines target high risk subtypes. And the original vaccines that came out targeted the highest risk of subtypes. And this is sort of expanded. Right now, we have a vaccine that has 9 different subtypes in it. So this is kind of expanded. So the idea where this vaccine is most effective is before you have ever been exposed to HPV. So that's why it's suggested in young girls, right? The idea is to have them vaccinated before they would possibly be exposed to HPV so that they develop the immunity. If you have already been exposed to some HPV, it's not going to make the HPV go away, but it might protect you against other subtypes. So the best vaccination window is in girls who have not yet become sexually active, therefore are not at risk of, having been exposed to it. It has also been suggested to vaccinate men as well, because HPV is the cause of other kinds of cancers as well. Besides the fact that they can spread it to women, there's recently been a big uptick in laryngeal cancer that is caused by HPV, which is affecting younger men. Anal cancers are another type of cancer. So this is why this vaccine is suggested for men who have sex with men as well, because these other kinds of cancer can be affected as well by the vaccine. So it's a little bit about the HPV vaccine. Like I said, it's usually offered to people in their teens. Yeah.
And I would say that,
So
just
go
to
ahead.
add to Dr. Starpoli's comment, HPV generally does not produce any symptoms. So that's another reason for sometimes part of the screening that we're doing. You may not have any pelvic pain or any discharge. Men most certainly are not going to have pelvic pain and discharge. And so that's what we mean by them being able to spread it, because they're usually asymptomatic. Again, with viruses, we generally clear viruses. We see it in the younger population, but that is the amazing thing about our comprehensive women's healthcare providers. Once they screen and something comes back abnormal, they set up the appropriate time to have you follow up. Following up for a couple of reasons. One, to make sure if your body is able to clear it, because most times it is, it's clear and it's gone, and there's nothing that you need to be worried about or concerned about. But two, if we still have things that are developing or still sitting, then as Dr. Starpoli mentioned, the colposcopy becomes important, and that's a referral out to our gynecological clinic to kind of do that procedure, follow up, and see where we go. So there's a collaborative effort and care that we partner with our women's health clinic together with our gynecological clinic.
So when you talk about gynecological clinic, is that here at the VA or is that
We do. So we're talking about our gynecology clinic that's here. For us, that clinic is seen as a specialty clinic. So your routine pap smear HPV testing is going to be done by your comprehensive women's healthcare provider within the women's health clinic, or if you're in any of our community-based outpatient clinics, then that provider is intertwined in our primary care clinic. So we have comprehensive women's healthcare providers within our primary care clinic. They are the ones that is going to do the routine pap smear or HPV testing that's needed. Now, if something comes back abnormal and after another follow-up with that comprehensive women's healthcare provider, if your clinician is still concerned about the results of the follow-up, then they may have a referral to our gynecological clinic where they are able to do our elevated, so that's that colposcopy, and look for additional testing and procedures to see where we need to go and what other treatment options may be available if that's what's needed.
although January is Cervical Cancer Awareness Month, do we screen for cervical cancer all year long? Do you want to talk about that?
We do. Screening is all year long. It does not matter when a woman veteran comes in. You could be newly enrolled this month and follow up with one of our comprehensive women's healthcare providers this month, and we would screen appropriately unless we have records from a previous clinician where we can verify the date of the last exam. So we want to make sure that we are doing routine screenings. And as Dr. Starpoli mentioned, we don't want to do anything that's going to be harmful. But the month and year become important for screenings, and whether or not our patients, our veterans, know whether or not their test was normal or abnormal. Sometimes just saying that it was normal sometimes isn't enough, because sometimes we say it's normal, but we want you to follow up in 1 month because maybe we did see some cells that we want to follow up. So it just depends. It's not just so much as saying the test was normal or abnormal. If we can get a copy, we are hoping and working with our veterans to share the information so we're able to get that information and provide the appropriate holistic health care that we want to provide. So we don't want to screen more frequently if it's not needed, but if they do need screenings, we want to make sure that we are offering them the opportunity to be screened, have their records here, and move forward with care appropriately.
How often do you recommend treatment? You said the date is important. What is important about the date?
So the data is important for a number of reasons. One, because we don't want to screen you too quickly. As Dr. Starpoli mentioned, sometimes there's errors in just routine screening. You had one a month ago. Do you actually need one in another month? Of course not. So the date and time does become imperative, more so because of our recommendations that have been sit down from the CDC, and then also ones that we have. So usually folks that have a normal pap smear and HPV testing would need to be seen again for 3 years. But that's a discussion together with the clinician and the patient. For some patients that may be at maybe more riskier lifestyle, they are sexually active and they are choosing how they want to participate in their sexual activity. We may not necessarily need to continue to do a pap smear every year, but routine STI screening is something completely different. And sometimes those two get confused because we bundle the terminology together. Sometimes we say that we're going to do your STI screenings with your pap smears, and we confuse patients sometimes by not specifying the difference between one and the other. You can get a pap smear, which is your routine clinical prevention screening, which is separate than you needing STI testing. A combination of that testing is, of course, cervical swabs, because we're testing for some cervical sexual transmitted infections, but also usually blood tests. So the two can be done together for a routine exam, but sometimes patients may need STI testing done more frequently.
Okay, and another question is, you said that once someone is exposed to HPV and if it's persistent, it's persistent. It's not like the body can clear it.
Mhm.
So if a person has been exposed to that persistent HPV and the body doesn't clear it, what happens then? Do they always, is it like any other virus like that you have for the rest of your life? What is the what is that? Can then abnormal cells appear at any time during that person's lifespan? So can you talk about what it is to have been exposed to the virus and it hasn't cleared the body? The body
Right.
hasn't cleared it.
Yeah, so I can talk about that. So a lot of times it does clear eventually. Most of the time it does. It doesn't, you know, what we wind up doing in people that test for HPV positive ongoing is that we wind up screening them more frequently. And they may wind up getting more colposcopies to look and see if there's any kind of change that they think needs biopsies. So that's kind of our very highest risk people might wind up, getting a colposcopy, every year or so, just to make sure that there's nothing really concerning because they are at such high risk. It's very similar to like colonoscopy recommendations for people who are used to that. People that have polyps and keep making polyps, they get more frequent colonoscopies. People who have no polyps and are at very low risk, they won't get a colonoscopy for 10 years. So our low risk people, once we've determined they're low risk, it's 5 years we're out to now. So, that part is pretty good. If they have a normal pap smear and normal HPV and no HPV, it would be 5 years. And there's a lot of other in betweens based on their past history, based on what a past colposcopy might have shown, based on what their pap smears might have shown. There's a lot of models to predict risk, and based on where they fall percentage wise about having an abnormality, based on studies, we determine whether it's 1 year, 3 years, or 5 years that people should follow up. And that's basically how we determine follow-up. And of course, these things are guidelines. They're not, that each person's an individual. And, we take some of that into account too, right? That's why we're not machines. That's why you don't go into a vending machine to figure out what you need in medicine, right? That's why you go to somebody who has a lot of training and judgment. So yeah, I think that's kind of what happens depending upon your risk, and having HPV positive on your pap smears, does put you at slightly higher risk. But what I always tell people is, we used to screen everybody every year. Now we're only screening people that we think are at higher risk every year. Everybody else we screen less often. And, most people are happy with that.
Yeah. So on the outside chance that someone does show their tests do show that they have a cervical cancer, how does VA Women's Health Clinic serve those women veterans if something has come up as positive, that will, a positive for cervical cancer? Like, what are the next steps?
So usually surgery, if someone were to have a cervical cancer, would be involved. This would go into the realm of a gynecologic oncologist, which is a surgical specialty of gynecology that deals with essentially gynecologic cancers, ovarian cancer, uterine cancer, cervical cancer. And we would send someone through the community to someone who has that kind of expertise. We don't have enough patients with these conditions here at VA that would make it possible to maintain a person with that kind of specialty. So here in Maryland, we have a lot of amazing super specialists, I guess I would say, and so we have people with those kind of credentials here in Maryland. So we would be able to partner with care in the community and get people to the kind of care that they need. We have in-house oncologists. We have radiation oncology here. So we have all of those specialties, but we don't have the gynecologic oncologists. But patients would be able to get that care through VA.
Okay, that's really good to know. And what is the survival rate if it's caught early?
So with most cancers, the earlier stage that it's found, the better the survivability. I don't know the exact quotes for each different kind of stage. And, I think everything is, kind of determined on an individual basis. But cervical cancer is definitely the type of cancer that the earlier stage it is, the less it has spread, the way better people do. So another plug for early diagnosis of this, because diagnosing this early leads to better outcomes, and diagnosing it before it even happens with with picking up the precancerous lesions, which we can zap with lasers so that they won't develop into anything, is an even better preventative strategy.
Yeah, I couldn't agree with Dr. Starpoli more. When it comes to us talking about survival rate, our CDC and our national statistics break it down in a number of ways. So not only do they break it down by what stage you're at, but there's also at times differences between age and race. So that survival rate looks different. They always look at a 5-year survival rate for most of it, but the numbers are significantly different depending on what age group and population we're discussing.
So, how can women veterans out there get screened for either for cervical cancer in any way, whether it's the test to find out if they've been exposed to the virus or if it's actually the pap smear or whatever else they need? How can they access VA healthcare?
So they're going to come and see us. They're going to make an appointment with their comprehensive women's healthcare provider in one of the clinics. So here in Baltimore, we are on the second floor. That phone number for the Women's Health Clinic in Baltimore is 410 605 7000, and that extension is 54981. You're going to reach one of our medical support staff who will help provide you with an appointment. And usually we say you're coming in for a well woman exam. That makes enough sense. And it also helps the schedulers understand exactly what time space and block to put you in. For new patients, we encourage them all to ask for a well woman. You want as much time as possible to go over medical history, any concerns that you have, and it also allows that provider to have enough time to screen appropriately.
All right,
The other thing I was going to say is that, we do offer, we have women's health teams, primary care teams at every one of our sites.
Mhm.
So this is the number for Baltimore, but people can also contact any of the community-based outpatient clinics. And each one some have multiple teams, all have at least one team, which is composed of a physician, nursing staff, who have all had training and are sensitive to the needs of our women veterans. And they all can do pap smear screening, cervical cancer screening, breast cancer screening. All of that can be done by our women's health teams, which consist of either general internists, family practitioners, family nurse practitioners, are the clinicians on these teams. So people can come on down.
all right. Is there anything that you want women veterans to know in general, in particular, and all veterans to know in general about the screening for cervical cancer or the women's health care, or what opportunities and services are available to women veterans here at the VA?
Well, I'll just round up a little bit about the cervical cancer, and I'll let Siobhan talk about, all the amazing things and wonderful things that we have been working on for women veterans. But basically, for cervical cancer, come get a pap, come get a pap smear. This is one of the big successes in screening in public health over the last century. It has evolved. We have learned who is at higher risk, who is at lower risk. This is a screening situation where we've been able to decrease screening and risks of kind of overdiagnosis. So pap smear screening, it's within reach of everyone. Our comprehensive women's health teams can do it. We also have our women's health clinic in Baltimore, where we have a women's health nurse practitioner that can also do this, who does well women exhibits. So there is definitely access to come in and get this done. Most people under the age of 30, it's every 3 years. Above the age of 30, it depends upon your past screenings. A lot of our younger people had screenings in the military. So if you're within 3 years and you haven't had any problems, it's time to come on down.
I would add to that for our veterans that have experienced MST. Our team has a very trauma informed approach to us providing this level of care. We realize and we understand that trauma plays a huge role into some of our women veterans wanting to even be screened. And so we have been trained in trauma informed care to make sure your environment supports what's needed to provide you with the best possible level of care. Our clinicians take their time. They are slow and methodical when they sit and talk with you. They will guide you through an exam so that you feel as comfortable as possible and create a reassuring, nurturing environment. So that's one of the huge benefits. We take the time to understand and provide the care that is needed. It is not a quick rush in and out of the clinic, especially for something as sensitive as this, and ensuring that you feel comfortable with the level of care that you are receiving. Our providers in our clinics are amazing at providing holistic care. So it's very important to what we provide. As we've spent this time talking specifically about cervical cancer, we do all routine screenings from diabetes to hypertension to cervical cancer and breast cancer. We provide it all. We collaborate together. We are able to provide pelvic floor therapy for those who have incontinent issues, pelvic pain issues. We provide reproductive health care across the gamut. So that would include our veterans that are looking to start new life, but also ones that may be having challenges and issues with perimenopause or menopausal symptoms, as well as our veterans that may be experiencing challenges with infertility. There are a number of aspects of healthcare that we are able to provide for you. The first thing that you have to do, though, is enroll, and that becomes huge and very important. Figure out whether or not you meet the eligibility to get the healthcare that we would gladly love to provide to you. And that starts with connecting with your benefits office and getting the information that you need. Once you have that, you want to reach out to us to get enrolled and then set your first appointment. Those things are very important for us being able to provide the best possible care for you.
All right. And do you help people get enrolled after they've been deemed eligible? Do you help them get enrolled or?
I don't do it specifically, but if they were to reach out to me directly, yes, I partner with our enrollment team to
Okay.
ensure that they are enrolled important, pretty much right away, and then we can go ahead and get them scheduled from there. So at times we can handle that unanimously. Throughout the year, we do partnered enrollment and benefit fairs. So it is a great opportunity for us to do both. I am actually planning for a summer what we call open house, which will allow our women veterans to look at enrollment and benefits at the same time. And if we're able to, we'll also get them scheduled for their first appointment. Once they determine that they are eligible and they're enrolled, we can wrap them right into their first appointment.
That's wonderful. And I will tell everyone to watch our pages, whether it's Instagram, YouTube, or Facebook, to keep an eye out for information about that outreach for women veterans. So, is there anything else you want to add before we say farewell?
Come. We are looking forward to serving you. It is a pleasure and delight, and we continue to grow and expand our program every year. Whole health is the gamut of what we provide, and we take that very seriously here on understanding holistically what our patients would like for health and well being.
All right. Well, thank you, Dr. Sarapoli and Dr. Kirksey. And I hope everyone out there enjoyed this show. It will be on all of the streams forever. It will never go away. So if you want to come back and rewatch certain parts, then do that. And I will talk to you soon. Bye bye.
Thank
Thanks,
you.
everyone. Bye.